I'm Maggie Bradley. I'm a practice nurse, and I'm also the clinical nurse lead for the enhanced training practice. And I'm also a Queen's nurse. And we started doing video group clinics, should I say, very early on, as they were rolled out in April, when at the start of COVID, really. And we're looking very much to include every group of patients that we could, really. And one of the groups of patients that we're most concerned about were patients with cancer. A lot of them had their treatment stopped. A lot of them were very isolated. A lot of them were really, really anxious and worried about shielding, about what was going to happen to them, and about everything that they were used to. They were used to having support from Macmillan. They were used to having support groups. They were used to seeing people. And it was really, really, really a struggle and an anxious time for that particular group of patients. So once we had done all our video group clinic training, the cancer patients were actually one of the first groups that we targeted. And we've done 2 groups with them now. The first one, we invited Macmillan to join us. So we had myself, my facilitator, my Macmillan support person, and our patients. And that was absolutely brilliant because she was able to link those people up with Macmillan services locally and nationally, actually. So that was very well received, and patients were able to speak to each other, which was brilliant as well. And then the next clinic we did, we ran it again, but we invited Move More, which are a group of physios who work very closely with Macmillan and cancer patients about keeping active through treatment, keeping active after treatment, fatigue, all these sorts of things that people with cancer who are going through treatment can be experiencing. So they're very much part of cancer treatments moving forward. And we invited them along as well. So we had our clinic of patients, myself, again, Macmillan support, and Move More. Honestly, it's the best hour I've ever spent doing a video group clinic. It was fantastic to see the interaction between these groups of people. So the patients bounced off each other. We had the best hour in terms of support, in terms of fun, in terms of learning, in terms of great messages to give people. What one person was starting off on his cancer treatment and another patient had actually just finished his. So the support they were able to give each other was amazing to see. The Move More girls from physio were joined in and were able to offer advice on how to keep active, how to deal with the possible side effects that this person may be going to experience when he started off on his chemotherapy journey. So they were really heavily involved. And then the Macmillan support, Caroline, was again able to pull it all together and keep us focused about, how we could help each other and how we could move it forward. And our plan moving forward actually is hopefully going to be a really good one, because we've got a core of 2 or 3 patients there who are going to join every group that we do, every clinic that we do. And then as other patients come in, they're almost going to act as their advocates, really. So we've got a core 3 people. More people are coming in to the next one, and we're going to send out digitally the links to the holistic needs assessment, the cancer care review. And so we're going to have all that information returned back to us, ready to go before we do our next video group clinic with cancer patients, which is at the beginning of November. So we started off quite small, and we've just grown it every time that we've done it, and we can see the massive potential for this group of patients. It honestly was the best hour of my experience, because to see the looks on those people's faces when they were interacting with each other and interacting with other agencies was second to none. And it filled me with absolute, it's like hope and joy, really, moving forward, because sometimes it's been quite tricky getting everything going. And when you see the results like that and you hear from the patients and the feedback they gave us, it really, really makes you want to carry on, and really makes you want to put yourself out to make it a success. So that's how we've gone about it so far, and our patients have really, really benefited from it. And Macmillan and Move More, as outside agencies, have also seen the benefit of this way of working, and are definitely interested with moving it forward in the future with us.